Liebe Kolleginnen, Kollegen, liebe Freundinnen und Freunde.
Dear colleagues, dear friends,
Ich habe mir natürlich Gedanken gemacht, wie beginne ich
of course, before, when I prepared this session, I was thinking, how could I prepare the introduction to the topic malaria? Even the harder, after we now had such a lively discussion about TB. And I tried to remember moments in which I, for the first time, thought about how to speak about malaria and about what we do. And what we do has a lot to do with thinking, how can we talk about this topic in a way that it gets more political support. I think it was in 2008, 2009. I was sitting in a small room behind a glass wall. Why? It was a focus group interview. And they wanted to check how a film about malaria could be received in Germany. The film was produced in the US, and I think everybody who sits here would also say that it was a very American film. In this film, the film was about a mother in an African village who realizes her child has fever, and she got concerned, and the temperature rose, and then she took the child and had to go to a medical institution. But since there was no healthcare center in her village, she had to take her child a longer way to a bigger town, and during this journey, the condition of the child grows worse and worse, and you don't know how the story ends, just the temperature rising, and very dramatic music and so on. And how does a German audience react to such a film? I was sitting behind this glass wall, and in another room there were different people picked, like coincidentally, and maybe you know that from market research, and then they debated about the film. And they said they found the film was impressive, maybe a bit too dramatic, and they would like to know whether there is really a problem or statistics or facts about the disease. And the consequence was that the film was not appropriate for a German audience, because the filmmakers thought probably a German audience wants more figures and less emotions. At that time, I thought the result was right. I thought maybe people don't want too many emotions, they want more facts, and that's very good. But when I thought about that film recently, I wasn't sure any longer. Why? If a film presents a terrible fate, why do you ask yourself whether this is relevant or whether figures are relevant? Because it is a terrible diagnosis. When we talk about malaria, the facts are clear. It is a disease where we have very many deaths that Heidemarie Wieczorek-Zoil called the silent deaths this morning. 1,400 children die each day of malaria. That's 4 jumbo jets full of children. And it's terrible. I think I've been talking 3 or 4 minutes now, so 3 or 4 mothers more are crying about their children today because they did not succeed to go to the next health care center. So when we talk about malaria, we don't only have the topic of treatment and prevention, but also we also have the topic innovations, a topic which gives us a chance. There are regions such as Southeast Asia where we are in a race, and we don't know whether we succeed in suppressing malaria until the resistance against the virus will be too big and there will be no hope any longer. So our hope is that we will be ahead of the development of the disease. And however, Lucica already said that with Corona, the development of vaccines was much faster than for tuberculosis. And that is the question of political support. And that is why I'm so happy that Mr. Ludwig is with us in the panel. When the Federal Ministry of Economic Cooperation and Development participated in a conference on malaria, they saw that we need more political attention, more awareness, and I am looking forward to our discussion.
Thank you very much, Sergius, and indeed welcome to the last panel, or the final panel of today's Get Back on Track conference. Already now I can say, wow, compliments to the organizers of this conference. That was super inspiring, listening these panels, and I hope we can just continue as the last panel. So there was no time for after lunch sleep. It was really exciting to follow that. Thank you very much for that. Yeah, let us start with introducing who's on the panel. And at first, my colleague Daniel, who is going to moderate with me. Daniel, please introduce yourself.
Thank you, Jan. Oh, can you hear me? Perfect. Hi, everyone. My name is Daniel Townsend, and I'm the focal point for the Developed Country NGO to the Board of the Global Fund. I'm based here in Berlin, which is news to lots of people, but I do live in this city, and I'm happy to be with you here. And again, big shout out to Peter and Melanie and the rest of the team for putting together a really well-run and informative conference today. I will quickly introduce the speakers. So to my immediate left is Elise Mbala Mecca, and she is a mayor from the commune Akom 2, based in South Cameroon, which covers around 30 villages and approximately 30,000 inhabitants, and is resolutely committed to community development and achieving the SDGs, including actualizing the right for health, and within that, a deep commitment to fighting malaria. I'm sorry, we are a bit pressed for time, so I won't go through your entire biographies, but you do have within your program a list of our very accomplished speakers, and if you want to know more about them, I suggest that you have a look at that. And then next to her is Dr. Karine Karima, and she's a medical doctor from Rwanda, and presently the interim CEO for the Rollback Malaria Partnership to end malaria, and she started this post in April of this year. Dr. Karima is quite well renowned. She was a special advisor to the board of the chair of the Global Fund, and also she was a senior program officer at the African Leaders Malaria Alliance and led malaria technical expert group panel for the Global Fund on malaria. She served as an independent consultant for many years, and I'm sure in her new capacity she'll be greatly welcomed in the malaria community. I have Dr. Marjam, is it Marjam? Yes, sorry, thank you. Dr. Marjam Gross-Rauschkamp. I've gotten a little better at the languages. And she's a senior advisor to the executive director of UNITAID. Marjam has worked in public health and international development for over 15 years, and before that, before joining UNITAID in 2021, she had several positions at the WHO, PAHO, Gavi, the Global Fund, UNOPS, and McKinsey, where she worked in several senior management positions. And next to her is my apologies, I think I have your, is the new alternate board member to the Global Fund, and it's a very nice pleasure to meet you. with us today is Harriet Ludwig. And Harriet Ludwig is a senior policy officer at the BMZ, Division of Global Health. She's now the new alternate board member for Germany at the Global Fund since August 2022. But she has quite an accomplished career. She was a member of the EU delegation in New York and a focal point for health and a negotiator for the HIV political declaration. In between 2017 and 2018, an alternate board member at the Global Fund and also a board member for Gavi, and a part of the German negotiating team for the SDGs and the 2030 agenda. Please welcome our panelists today. Thank you. So the way we'll do it is it's pretty much the way we followed some of the conversations earlier. And I'm hoping that we'll have some time. We only have just about an hour. So we're hoping that we'll have a bit of time for maybe one or two questions. And I'll kick it off with a question to Dr. Karima. So the Global Fund provides around 42% of international funding for malaria programs. And since its inception, we've seen around a 45% decline in malaria mortality. However, despite this, and as we heard earlier, malaria mortality is still high and in many cases can be avoided. Considering that malaria is also one of the leading causes of death for young children in some countries in the global south, what further action can end malaria as a threat, as a global health threat by 2030?
Thank you very much, Daniel. First of all, I would like to thank the organizer of this conference, Get Back on Track conference, for inviting me. And it's really well organized and very inspiring, especially as we see what the Global Fund has done in our countries. So I would like also to tell you that I'm so glad to be here to testimony the commitment for Germany, and I really thank and hope you can send the regards from the Rollback Malaria Partnership to End Malaria. It's really great that they are committing and they are also increasing the 30%, meeting the targets that the Global Fund wants. And I think Germany is among the first from the G7 donors who are committing for the Global Fund for the 7 replenishment, and we are really thankful. So in terms of malaria, as you say, the Global Fund is supporting around 42% of the malaria program. And maybe people are just looking at just 42%, but I think it's really important to see in terms of lives, in terms of malaria cases. So with the support of the Global Funds and, of course, other partners like the Presidential Malaria Initiatives, the Bill and Melinda Gates Foundation, between 2000 to 2010, we were able to reduce malaria cases by 60%. So 60% is 2/3 of malaria cases that was reduced thanks to the support of the Global Funds, without even talking about the number of lives that were saved, because we were able to save at least, to contribute more than 44 million of lives. And this is really great, and we are really thankful for all the impact that the Global Fund has in our communities in terms of the malaria fight. So when you say what do we need to do, although we had a decline of malaria cases and burden, for the last 2 years, unfortunately, we are not on track. We are going backwards. Of course, TB, we are having 1 million cases per year, but for malaria is also quite important. We are having 627,000 people who are dying from malaria every year. And then in terms of maybe the burden per day or per, what I can say, it's we are having 1 child dying every minute from malaria. So this is the burden. This is what is affecting our community. So 1 child is dying per minute due to malaria. We are not on track because when we compare the last years, we have increase of 69,000 more deaths due to malaria. So last year we had 627,000 deaths. 17 million of malaria cases last year. So it's really important. And it's really unfortunate, as my sister Luchika was saying, malaria is a preventable and it's treatable disease. So if we have the funds that are needed, so we are not even getting to 50% of the malaria funding that is required to sustain the fight that we are having today without adding all the innovation, the new drugs, the new vaccine. So it's really important. So we need more funding. This is what we need, and that's why we are here. And then we really appreciate the commitment and the leadership of Germany in the global health, especially for the 1.3 billion that they are announcing today. We need also innovation. We need new vaccine, and it's really also a great pleasure that today there is the R21 M-Matrix vaccine that is released the funding that is showing that they have achieved the efficacy of more than 80% vaccine efficacy for malaria, which is great. So we need new tools, we need innovation. We need also to use better the existing resources that we have, the existing tools. We need to target and achieve and target the most affected people, because malaria, it's a disease of the poor. It's the disease of the people who don't have access, who don't have ability to fund their health. So it's really important that we increase funding for malaria, we get new tools, and then we also use better the tools that exist. Thank you.
Thank you. Over to you, Jan.
Elisenbala, we heard you are mayor of a commune in Cameroon, 30 villages. Can you just describe us a little bit what's the situation in your commune regarding the fight against malaria? Why did you choose especially to focus on getting engaged against malaria? And I think you supported community workers also in your town hall. Perhaps you could describe and tell us a bit about it.
It's open? Okay, thank you. Yes, it's a great honor for me to be here today to talk about our experience, something that we have started very far from here in our very deep forest, South Cameroon. It's just amazing for us to come here in Germany to talk about this experience. Thank you for that, and congratulations for the organizer of this conference. My country, Cameroon, is well known for his football. I think you know some of our stars. And I hope that after my speak, you will better know my country about the fight against malaria. So our experience was just to show what we can do by ourselves with our own resources to fight against malaria. As you can see, I'm a woman, and in Africa, mainly in my council, women are involved more than men in the health of the family. And I can see today that most of speakers here was women. Maybe we have to encourage us, because women are very involved in the matters of health. So we started by saying that in our council that is in a rural area, we have many cases of malaria. Children, pregnant women, adults. And our government started to train the communities, health workers, and this program stopped. Then I was elected in 2013. From 2014, as a female mayor, I've started to place the health of the population in the center of my preoccupation. We are potentially rich, but a lot of our resources are not exploited yet. But we have forest, and I have little resources from forest. It is that resources that we put in the fight of against malaria. We started to train 30 communities, health workers. Then we gave them medicines. Yes, we gave them medicines so that they can go very close to the population to make the test, to give them the first medicines. And because I'm mayor, I know each of my pupils. And these communities, health worker, know also the people of the village. They can see that this morning, this child doesn't go to school or didn't go to school. Why? And they can just go and test him. If he have malaria, they can give the medicine. They can also encourage the pregnant woman to sleep under the mosquitoes nets. And even they can encourage the children that have been vaccinated but that have stopped their vaccination to go to the center, health center. And before COVID, we had a very good results. When COVID came, it was really dangerous for us. Myself, I had at the same time COVID and malaria. You can imagine the catastrophe. And in the rural area, like in my council, the roads are not good. For some of our population, it's very difficult to go to the health center. That's the importance of the community health workers, because they can bring the medicine and the treatment to the people that cannot go to the health center. This year, on March, I've created an association of 20 female mayors, of 20 councils, and we hope for the next budget they will put the money for fighting against malaria as we did in ACOM 2. So it is really with our resources, with our people, that we are fighting against malaria since 2014. Excuse my English. It's my very best English. That's I'm trying. At the same time, we train the same community health workers to sensitize people about COVID, about HIV, and other small diseases. Now, our government knows that we do that work with our men in our territory, and we are just hope now that we can share this experience to the other councils, mainly in our association of female mayors. Thank you.
Thank you. So the next question is for Harriet Ludwig. So the BMZ finances the Global Fund, which provides around 42% of global funding for the malaria response. What do you think needs to happen to achieve the goal of ending malaria by 2030? We've heard a lot about the shortfall, even in the investment case that the board did put forward, and Peter Sands even this morning saying this is the bare minimum that we need to get back on track, using the language today, but and also to sort of protect the investments that have been made. But in real world, in a real time thinking, and this was also a feeling at the board, we understand that this is not enough. So while it's applaudable what Germany has done, and I'm really hoping that many other donor countries will fall behind, it will get us somewhere, but as you've heard, there's still quite a far way to go. What else do you think donors like Germany, and in that case from the BMZ, weaving in your perspective, can do to further demonstrate its commitment to supporting areas of meeting the malaria target for 2030?
Thank you for that. 2 questions. Perhaps let me thank also for having the ministry and also myself here. I would like to start with bringing over the greetings and the apologies of Dr. Tanja Vorwerk, who was supposed to be here, our Deputy Director General. You might be puzzled if you follow the instructions of looking into the longer bios in the program, because I didn't change my hair color from blonde to brunette overnight. So I skipped in because she was not able to come due also to a medical background. So thanks for having me here. So on the first question, what needs to be done? I mean, we've heard a lot of issues around money is not endless and we need to make the best of it. So I think the first answer is to really look at smart solutions, and I think one smart solution of making the best and the most efficient of the money is to look for holistic approaches. And I think we've heard a lot of integrated services. I think if you look from the perspective of the beneficiary and the patient going somewhere, they don't want to be handed over to the HIV nurse or to the malaria nurse or go to a separate centre de santé for TB. So I think if we look at this more integrated, then it might also help to save some money. We've heard also from Lucica very good examples for saying, well, this is one device which can trace several issues. And if I go back to my personal experience, I lived for 7 years in Western Africa. When I was diagnosed for the first time with malaria, it was a very atypical one. I went to the clinic for having abdominal issues for 10 days, and I fainted in the couloirs. The first thing they did is they did a malaria test. I didn't have any fever. And I woke up and said, oh, I'm dying of something inside me. And the first thing you will think of is malaria. And they said, yes, and you're super positive. Thank God you made it. So saying from my perspective, it was nothing I would have gone for a malaria test. They definitely saved my life, and I know many people didn't have that luck. So I think that's leading over to the second point. Prevention is really the most important thing to look at. Sensitize people, continue to really reach out, like we've heard good examples for sensitizing people for going for that integrated approach and having it. Because compared to the treatment and the loss of life, testing and diagnosis of malaria is easy and is relatively cheap. It needs to be affordable, and you need to have the access right next door. So the more access points you are having, I think that's an important issue. We've mentioned innovative approaches, looking at new developments. We are quite optimistic and very much thrilled about the vaccine. Although we see this is not a silver bullet requiring 4 vaccine shots, I think it's a hard and a very disciplined approach needed to get this on time. I've sit on the Gavi board as well, so I know a little bit the logic of having vaccinations administered in the good time and at the right moment, so you're not contributing to either losing vaccinations or not contributing to any resistances. I wanted to also allude to the issue of this holistic approaches because we all only look in silos, also on the funding of the Global Fund. The Global Fund is also, that's a very strong point for Germany, invests 1/3 of this 18 billion slide slip, for health system strengthening. So the question is, what do you put into this health system strengthening? There might be a lot of innovative leverage to look at this and say, well, this is not what we put in the silos, but this is how we train people, this is how we invest in screening methodologies, which will benefit the 3 diseases. So finally, for the disease split, this is not that you get only part of the disease, but you can make the smart investment by looking, and I think this is also what everybody can bring back to the communities and where civil society can also play the role to say, well, really invest into this considerations of how you make the best out of the $1 through health system strengthening. The second question. The second question is, what does the ministry do? I mean, we are very much relying on multilateral approaches. We think this is the best way to go in fighting global epidemics, pandemics, whatever. These diseases don't need a kind of bilateral approach, at least not a bilateral approach only. We have a specialist for 20 years, which is the Global Fund. So we don't have any intention to say, well, why shouldn't we change the winning horse, we say in German. Never change that. The Global Fund is also a strong market shaper that goes back to the efficiency argument. So we wouldn't be as efficient bilaterally as the Global Fund can be. And we are very happy that the Global Fund looked more and more into this health system strengthening, which we have been advocating for quite a long time. Perhaps to add, I mean, we also have bilateral programs. We are still active in 28 countries, mainly looking at the health system strengthening approach, which benefits not only AIDS or not only TB or not only malaria, but where we hope that that will leverage also for the benefit of all the diseases. I think I will try that. Thank you.
Thank you very much, and I think we will continue the discussion in the next round and further look on exactly these aspects, holistic approach, the interlinkages also with of 3 big diseases tackled by the Global Fund explicitly, but perhaps also, I mean, we just got the hint by Mrs. Miller. She said there are also other diseases tackled. We heard the neglected tropical diseases before, infectious diseases. So I think that's quite interesting, especially also for the malaria. For the fight against malaria, to look at these further points. But first, let's stay on malaria, and you, Miriam, Unit Aid. What's the contribution of Unit Aid to the fight against malaria? We heard from Peter Sands this morning, progress has slowed down. We heard there are new challenges. The mosquitoes, insects have learned. So what are your answers?
My answers, yes. Thank you very much, and thank you. I want to add my thanks to the organizers of this conference and for inviting us. It's really a pleasure to be here. You ask about Unitate, and by the way, I'm very glad that different people have spoken about the need for innovation in health, particularly in malaria, to combat not only malaria itself, but also the growing resistance around it, because that's exactly what Unitate does. So Unitate works with people in affected communities, implementing partners such as the Global Fund and our scale-up partners and technical partners to identify really game-changing health innovations, including in the space of malaria, and to ensure fast and affordable access to them in low and middle income countries. We do that in the area of HIV, TB, and malaria, but also for women's and girls' health and for pandemic preparedness and response. Our work, I would say, is very much needed because and I think that was pointed out before as well, while many health innovations are often rapidly available in high-income countries, it can take years or even decades for them to arrive in low and middle income countries. Some of them are too expensive. Some of them hit regulatory hurdles that they can't cross. Some of them, like child-specific formulations, are often never done because the market is perceived to be too small around them. Others don't get the WHO guidelines that are needed for countries to then access that particular drug or health invention. And that delay in getting health innovations to low and middle income countries leads to millions of lives that are lost, billions that are wasted in terms of money, and the whole response takes longer and is less effective. And that's where we come in. We are really working to make sure that we identify the most promising health innovations, that we invest in them, that we make sure they cross the access barriers, and that they then, working with the Global Fund and other implementing partners, that they then made available at scale in countries. We have been investing in malaria quite heavily since we've been established in 2006. So we are investing heavily in prevention, diagnostics, and treatment. For example, we have been quite instrumental in getting the seasonal malaria prevention, chemo prevention, which is one of the key tools to prevent malaria in children. And which has since, I think, averted 500 million cases of malaria in children and saved probably 100,000 since and been reaching 33 million children since. We have also, as you just mentioned, been investing quite heavily in the malaria vaccine. And I'm very glad also about the new results, about the latest one, which builds on the one that was previously pre-qualified by the WHO. Maybe I stop there and hope I answered your question.
It did, and I would like to pose another. The pandemic now. I mean, I was a bit shocked, and I think that's true for HIV, malaria, and TB programs, as well as for NTD programs. That so many programs were interrupted and were thrown back instead of being used for fight against the COVID-19 disease as well. So being used for it. What was your experience with that? Have you experienced also thrown back there with the programs against malaria? Or I mean, as far as I understood, it was quite well adapted, quite soon adapted also to integrate a fight against malaria, against COVID-19.
Yes, I mean, I think the COVID-19 response has really been a big throwing back all efforts across HIV, TB, and malaria, and it's been, I think we're all scrambling to try and make up for that and to get back on track. Unitate has been working on a number of approaches that can help, particularly with the setback in other areas. For example, we talked about integration. So if you can find integrated diagnostic tools that can not only diagnose malaria but also TB and other diseases, that's something that we are heavily investing in, as well as really investing in a host of new vector control and new preventive and treatments for malaria to make sure that we get back on track and can achieve the SDG goals by 2030 of ending malaria.
I think that's a good point to pick up on for the next question, which is to Dr. Karima. So much has been made about innovation, and within the malaria space, certainly there have been lots of innovation, both in terms of service delivery, but also importantly in new drugs. And this has led to a lot of progress. There's a sense, at least there's a sense, I feel like there's a sense that, you know, you can really turn the tide on malaria with, to Harriet's point, smarter investment, getting rid of waste and finding efficiencies. Now, if you were to think about the progress that has been made, and then that's, you know, thinking about the progress that's been made, and then just looking prospectively about where we want to go, what do you think we need to do to get us to the 2030 goals?
Yeah, thank you, Daniel. So, first of all, for us to get to the 2030, first of all, we need to be optimistic. We need to, I mean, people are used to live with malaria. It's normal to live with malaria. So we need to show that it's unacceptable, first of all, to have malaria. This is number one. Number two is smart investments. So before we innovate, can we use effectively the resources that we have? And for me, the best progress that we did for the last years is the use of data. To know where is the highest burden, where is the most affected people, and target those people who have malaria. I think this is the best use of the current resources, because we have seen that with the resources that we have today, last year China and El Salvador have been declared malaria-free countries. Of course, we have been slow for the last 20 years. It's only 21 countries that have been declared malaria-free, but we want more. So that means even the resources that we have today, we can reduce malaria. And Rwanda, my country, we have shown that we have seen a huge decline of malaria for the last decade. So this is number one. Number two, we have had innovation. Of course, I'm not going to compare myself with, I'm becoming like my sister. I'm not going to compare myself with COVID, where we have seen vaccine development within less than 2 years. Because, less than 1 year, in 10 months. But for malaria, of course, we don't have TB, and I'm sure we are going to get the TB vaccine with the mRNA technology that has come thanks to COVID. For malaria, for the last 50 years, we have now one malaria vaccine, and the second one today is showing that there are great results. So we only have one vaccine, and of course, which is not even stopping the disease. It's just stopping the severity of the disease, the number of clinical malaria episodes. So innovation. The biggest innovation we are seeing, because of all the challenges that we have in terms of drug resistance, insecticide resistance, now we have the new generation mosquito nets that are really showing that you can even get a decrease of 44% of malaria cases, so it can prevent the disease. So this is number one. Number two, my colleague has said seasonal malaria chemotherapy that is really preventing malaria in the Sahel. Countries where you have children that have every month they have a clinical malaria episode. So it's really helping to prevent the disease. So on top of the mosquito nets, the SMC, we have also domestic funding commitment from countries, leadership, political will. So we are seeing that more countries now are deciding, and we have seen with the Kigali Malaria and NTD summit that we had endemic countries committing to 2.2 billion of funding to the Global Fund for this cycle. So I think it's really very important. Those are really the progress in terms of the use of data, innovation of new generation of mosquito nets, SMC, as well as the vaccine that is coming. And of course, with COVID, with the mRNA technology, we are sure that we are going to get even more innovation. But the most important is to use effectively those resources and target the most affected for us to achieve our goal to end malaria. Thank you.
Mayor Meka, when you hear about these innovations and new vaccination against malaria, does that arrive already in your commune, or what are the main problems you face in your commune with malaria in terms of affordable access to prophylaxis, getting the mosquito nets and so on?
What I just want to say is that as malaria doesn't wait, because malaria is very rapid. Sometimes, even if you have money, you cannot reach the center, the health center, because malaria is going very, very fast. So I think we cannot wait the innovations because we know what to do to end malaria. We know it. I will join the others to say thank you to Germany. We need funds. When I see the results, the small results that I have in my council, if I have more resources, I can fight more. And my experience will benefit to others. So I don't know if it is really a matter of innovation. It's true that mosquitoes change and you have resistant forms, but even the forms, the simplest forms are very dangerous for people. And I'll say it, but I think we can also consider or take care of therapy from plants that we use a lot in Africa. Maybe we can just see if we can add the two methods, those plants and médecine from, comment on appelle la médecine occidentale? C'est là. Pour dire qu'on peut associer les plantes qui ont montré leur efficacité avec la médecine moderne. We can
have a combination of natural remedies and
with modern medicine.
Yeah.
Yes, and when they give the mosquito nets in Cameroon, the people of the towns has it before we in the rural area, because roads are really very, very difficult. So for me, the interest is that the local authorities like me have to increase the interest in the fighting of malaria. It is a political decision, it is a political engagement, it is also a political matter. Because if you just go in matter than giving water, giving electricity, education, and people are not in health, for me it's just like you put something in the ocean. So we have to take care first of the health of the population. That's why, for me, it's a political engagement. We need from our government more money. We need from the local authorities like me, more money in our budget to fight against malaria. Now, if the innovation come, it will find us. It will find that we have started the fight against malaria. That's what I can say.
Thank you. So my next question is to Harriet. So I want to pick up on what you mentioned earlier regarding HSS, and certainly Germany has been one of the loudest voices pushing the HSS conversation, and I think it's an overlooked area, but I think now people are beginning to understand that strengthening the health system, along with community system strengthening as well, can yield better results and better investments. And I just wanted to wonder if you could go a bit more into the approach that the BMZ takes, and this could be this could look at some of the bilateral programs that's in the 21 countries or so that you mentioned, and how that approach can also lead to strengthening access to medicines and to vaccines for malaria. Yeah.
Okay. I mean, as I mentioned before, the main avenue for us to fight malaria specifically is to go through the multilateral approach. So what we really try to do with our bilateral engagement at country level is to kind of pave the way for a docking station for whatever disease might emerge. So to have the system itself being adaptable and resilient. But perhaps I can also allude to something which I anticipate that the question is meant to, and which I have to also be very frank. I mean, I spoke up in the morning when I said, well, we are one government, but we have shared responsibilities in terms of which ministry does what. I think you're a little bit looking at what are we doing and also in promoting innovative approaches. And in that term, I can only say, well, what we do in the government is with the Ministry of Science and Innovation, and we have product development partnerships, which specifically look into the overlooked areas. So this is, we know this, we have a very close cooperation and relationship with them, because the specific look is to fight these diseases and to find new products, be them more efficient, be them better accessible, be them better storable. Oh, sorry, I will pick that up later. They have yielded some impressive results. And what we've also identified, and I know that there has been also discussions around this, is, thank you so much, how can we then bridge the gap between having new products, possibly also supported with governmental money, and then how do they really make the jump into the market? And there might be a gap. Usually, if these product development partnerships are set up, they also have a look at the rollout strategy. But of course, that requires a very long-term perspective and a very long-term strategy. So we're actually looking into a program or a project of identifying whether there is a need of filling that gap. So that would be our contribution of looking how to link the dots between what others have already developed. How could we make this to have the best use in the countries, and how make it work? Because that requires something, some seed money, some rollout. We all know about the ring, which has been something we've also promoted for the development, which needs time, years, decades even, but which might be worth to be leveraged to the next step. I don't know if this is kind of the question was.
Some of the question, it was, I mean, part of it was about access. Because of the stuff that you'd mentioned around the approach and what I know Germany really advocates for in terms of health system strengthening, I think sometimes that link between access and health system strengthening isn't fully, people don't connect it, and I think you did that. But also you mentioned market shaping, which is a huge thing that I know is the Global Fund was discussing a bit, and we'll see how that shapes up in the next strategy. And there's a whole market shaping strategy to accompany the next efforts in 2023 to 2028 or 27. Sorry. So I think yes, you did answer it, and certainly there is a lot of it is technical. I feel like sometimes when we talk about, there's a lot of emotions and other things that can come into it, but there's some technical elements about how you move from development of drug development into, in getting into the communities where Mbala is, for example, in her commune, and so on. So I do think you did cover that, and that is a part of where I think a lot of work is needed to sort of really make that case and for people to understand the link between development and access. Over to Jan. I think we have one more question in this round, and probably go for a final round of questions after.
Yeah, or I think we can then also open to the plenary. So get prepared already if you want to enter to the debate or wave. Perhaps a last question to you, Miriam. When you hear these debates already in the earlier panels, already on more integration, how to better tackle overlapping issues, how to better tackle comorbidities between perhaps the three diseases in the fund, the HIV, TB aspects, but also perhaps further infectious diseases. What's your perspective on that? Is that getting too complicated, or how can we get that solved?
No, thank you for that question, and I think that's hugely important and really the future. We need to make sure that we have inclusive approaches and stop the siloed approaches for diseases, and that particularly I think around HIV, TB and malaria, where, for example, what I mentioned before, the diagnostic, if you had one diagnostic tool that could really help you know whether the child has malaria or not malaria, for example, would already get us, and you could at the same time test it for HIV with a simple blood test or a simple whatever test. That I think would go a long way in also in combating resistance and in making sure children get the appropriate, or children or grown-ups get the appropriate treatment. So I think that's one area definitely where you need to invest in inclusion. The same for prevention and treatment. I think, for example, about the area of women's health and around malaria, again, if you think about pregnant women and the treatment that they need during pregnancy in order to not be infected with malaria, that is something that can really be integrated well with a lot of other care during the antenatal care that women receive. So I think there's, in prevention and in treatment, there's a lot of opportunity for all of us to really work together and make sure that we align all the dots, including in research and development and in the innovation space. So I think that will be even more important going forward if we want to get back to the 2030 targets. So yeah, I think that is you hit the nail on the target.
Thank you very much. So, do I see anybody here? Olivia, who is also our rapporteur in that session, we heard her on the panel this morning, on the AIDS panel. Please.
Thank you. I'm happy to be the rapporteur, so I'll get to include my own thoughts.
Great.
So thank you so much. It was a very, very informative session, and my comments or my questions for all the panelists is: we know we have a goal, 2030. To end the three diseases and to really beat malaria. So we also know we have 8 more years left and we are going backward. But the good news is, like Dr. Corinne said, we should be optimistic because with malaria, between 2000 and 2015, in 15 years, we were able to reduce death by 50%. So we made tremendous progress in the past, but now we are going a little bit backward. So my question is, how can we make sure that we can reach our 2030 goals? Because we don't want in 2030 to actually set up another goal. We really want to make sure that we can reach this goal, beat this disease, because we really don't really talk about what happens if we are not back on track and quickly. Unfortunately, with malaria, we are dealing with mosquitoes who are mutating. So we don't want to get to a level where we have a mosquito that has mutated and we don't know how to treat people. And we don't want a bigger, one of the worst crises in the human history, because people will get bitten and we won't have solutions for that. So what is coming if we don't get back on track quickly is really bad, and we have a timing issue. We are taking our times, we are disgusting, but in the meantime, the mosquitoes are not disgusting. They're actually mutating really fast. So how do we make sure that we get back on track quickly? And in those 8 years, we really put all our efforts to reach our 2030 goals and to then have more funding to develop our countries and do other things with that.
Thank you very much, and I think we can perhaps... here's another one. Here, go ahead.
It can be for anyone, but Corinne mentioned something like that, is the use of data. And we spoke about integration. COVID scared us so much because every day, almost continuously, we had on the screens of television everywhere how many people were tested, how many died by gender, by region, by village, by everything, right? If people will have access to this kind of data about malaria, about TB, about HIV, about road traffic, doesn't matter, about what kills the people more in a respective country, that might be a communicable disease or not, you will see that the attention of people will change, right? Of politicians, when you see how many people are dying every day for different things, right? In spite of that, for our diseases, and here I speak about the three, TB, HIV, and malaria, none of us have live data. We in TB have one country in the world, which is India, having live data. You connect now and you see what happened till yesterday, how many people died. It's one country in the world. Maybe there is one for HIV, I don't know, for malaria. My point is, you see, there is so much investment on health systems. Data availability and use, it's a pillar of health systems. So the donors, when they put this money for health systems, let's build something that remains, because we are in 2022, you know what I mean? And the official data we all have here to operate are the WHO endorsed data that speak what happened in 2021. So it's like you try to do a forecast knowing the weather of a week ago when you want to look ahead. That's what we have officially, huh? All of us, not just one of the diseases. So my point is, can, for example, part of the health system investments, for example, Germany, to say, we want to leave one thing. We want to leave perfect data systems in the country that are live and are helping the countries to really, we support to monitor and make the interventions that, we fix one thing, data. No, we don't want to fix all the health system, but let's fix one thing, because even that we didn't. So thank you.
Thank you very much. Yeah, very important aspect, I think. Part of the truth is that Germany invests now 30 million a year in a new data hub of WHO. We have to wait, of course, how it performs. Yeah, but one has to be honest with that. No, thank you. I think you were addressed, Dr. Karima and Harriet Ludwig, perhaps as well, and perhaps you can also add answer to further question in that regard. We heard it from Sergius in his introductory remarks that there's just late of June taking place this Kigali summit on malaria and NTDs. German government also participated there with a video message, at least for the state secretary. What are your takeaways from such initiatives? And Dr. Karima, I addressed that also to you, as I know that before you worked also on the Rwandan national control program on malaria, as well as in this unit tackling both diseases. So Rwanda is really in front with that aspect. Please.
Yeah, thank you very much. So maybe before I respond to your question, I will respond to Olivia, and it's as if Luchika was speaking in my mind. So for us to get back on track, number one is data. Data, not data for the number of cases, data in everything. So, and what is very important is how can you use the existing tools to target the most affected people, to know who is sick, where, how can I test the person, how can I treat the person on time so that we don't have death and then we don't have more, because as you know, it's a mosquito that is infected by the person. So if everyone is clear in terms of parasites, the mosquito that will go and bite another person will not transmit the disease. So the most important is data. When I say data, it's really good that Luchika say timely data, really time data, but we also need data for other, like insecticide resistance. We need to know that here there is insecticide resistance. We are not going to give the normal mosquito nets that we have, and then we give the most expensive. You know, the problem is, I'm sorry to say, it's most of the partners or the donors, they want to have at the end of the year a report of you have protected 1 billion of people with mosquito nets. But you don't care about was the mosquito net efficacious. That's the most important. So because, for instance, when you see the insecticide, now we are going to change, we are changing insecticide from a $7 insecticide to a $24 insecticide to spray a house. So, but the problem is, if in the budget you give last year is the same with the budget that you're giving next year, you don't want to have a report that's showing last year you protected 1 million houses, and this year you're going to protect only 20,000 because the insecticide is very expensive. So we need to avoid the issue we had before. Before, HIV treatment was only for the northern countries. People were thinking that in Africa, you don't deserve to get the HIV treatment. And we had really good people like Paul Farmer, Partners in Health, who were really advocating to have the same treatment, same quality preventive measure in African countries. And this is what we want. We want data that is showing the reality in terms of the efficacy of the drugs. When there is drug resistance, can we use the most efficacious, even if it's more expensive? So this is number one. Number two is how can we get access, increase access? So in terms of malaria now, we only have 30% of children that are getting access to treatment in the public sector. So that means we are having 70% of children, we don't know where they go. We have the private sector, but what is the drug, the quality of the drug that is in the private sector? So this is something very important. How can we get access, most affordable treatment for everyone? So get people in the village, get people in the forest. We are having now wars. I'm sorry with Ukraine, but I'm imagining how difficult to get access to the treatments, being HIV and tuberculosis. So the most important. So we are talking about community health focus. It's really sad that today to see that we only have 2% of children that are getting treatment from community health focus. And those are the people who are close to the community, who are living within the community. As Madame Mayor said, they know in the morning that this child didn't go to school. But if we give access to tests and treatment to the community health workers, they will get access, they will treat on time, and we are going to end malaria. So those are to get access, affordability, and then also to target the most in need people. And of course, when we have innovation, how can we there is the market shaping. How can we get access to affordable innovation? Because when you have innovation, so we are seeing the new vaccine, the malaria vaccine, it will be $24 for the 4 doses. how many people can get access. So I think those are the key points that will help us to get on track and then achieve our 2030 target. So in terms of the integration, malaria and NTD, so we are really sorry. This is an opportunity for us to talk, and we really need to talk because we are in charge of advocacy and communication. So in terms of integration, as you say, I was the director of the Malaria and NTD national program in Rwanda. So what we did in terms of integration, we used to do the mass campaign distribution of mosquito nets. So what we did since 2005, for the first mass campaign distribution, we distributed more than 2 million mosquito nets, but at the same time, because we were targeting children under 5, we also gave deworming. And this really helped us to really have a decline in terms of all the STH and get great progress in terms of malaria and NTD. So what is important is how can we leverage the funding that we give, for instance, for malaria, to also build in terms of the laboratory system. How can we have seen that with COVID, we are using the TB facilities. We are using the TB lab system to also, and HIV, PCR machine and so on to do the testing for COVID. So it's really important that every time when we invest in health system, we also try to see how we can integrate prevention as well as management of the 3 diseases and other diseases. Thank you.
Thank you so much. I'm afraid we are a bit running out of time, but a brief statement from you.
I'm standing between this panel and your after work drink. Okay, let me try to wrap up on all the 3 questions. I think Corinne mentioned a lot of important elements, so I'm not going to duplicate this. Perhaps just some flashlights. On the data issue, linked to what needs to be done until 2030. I think data is an important part of it. It's, of course, also, the other part also will be the narrative. I think we've discussed already a little bit around how do we sell the story. So going back to the beginning where Sergius gave the introductory story, data might fly, but also the personal affection might be part of the story. So I think the narrative around malaria might be data, but might also be other factors. Data is super difficult to get. I mean, I don't know who in the room followed, probably a lot of you, how Germany was handling the COVID data. Yeah, so, and definitely it's not up to the German government to say, well, you have to invest in data. Our approach is, of course, the partner countries identify what they need and we support them in it. So that on the remark on data, of course, it's incredibly important. We've heard a lot of things about integrated services. Another one on, what was it, deworming, and, you know, offering something from the beneficiary perspective. So this is not the last mile. This is the first mile for the mother or for the patient. This is the first mile. They are just feeling not well and then bumping into, hopefully, a centre de santé. And the question is, what service is provided to them? And what blood samples and what laboratory can help them. So think in changing the perspective for integrated services. What do we take away also from the discussion and also from Kigali? I think there is no silver bullet yet. We still have to look for combination of measures in prevention, in rollout, country-specific, community-specific approaches, waiting for the silver bullet, which might be a vaccine, but still this is the better way to go, and which also puts the legitimate approach of country specificities. And the last remark on innovation, I mean, we've tapped on this a little bit, but innovation is only part of it. Once you have the product, you need the rollout. I just mentioned this briefly, but this is about the country needs to be ready. I mean, we've seen this also with COVID. It's not that the product is there and it sells itself. You need to look at the demand. Which country really has a demand for it? And if there is no demand and you're very convinced, then you need to create a certain demand. You need to have a strategy. The country needs to be ready for the rollout. I mean, it's not the same thing like for vaccines who are shelf-rotten easily, but nevertheless, these are always angles we need to look at. If we talk about innovation, also look at it from the end. Last thing on innovation is, this is a very dear point to the German government and to the BMZ, is also once we have something, might it be existing or new products, we are really very much investing in local production. We need to spread the production basis because we can't afford that. We're just looking at 2 or 3 producers globally. So increasing the global production, the local production, be it for vaccines or other pharmaceutics, is something we are heavily investing in. We started with 530 million. And the overall goal is that it's not only for COVID, but that the production sites are able then also to look over with the technique which are provided to look for malaria and other vaccines or therapeutics. Okay, thank you.
Thank you very much. Wow, I thought 75 minutes, that's really a lot, but now I think we would need a little more, but okay, we have more time to discuss and ask further questions afterwards now at the reception. Thank you, great panel, wonderful panel, thank you all. And now let us hand over to our colleague Frank Michaud from the Kindernothilfe for closing remarks, and I think we can sit down, yeah.
Thank you. Just before the reception, so I make my closing remarks short. I would like to end this inspiring day with just a short wrap-up before the farewell and reception. And my message is, well, it's very clear we got today a very strong message by the BMZ, and I'm very happy to hear that the 1.3 million are 30% more. And this is extremely important because we know that the German government has its constraints with the budget discussions, and it wasn't easy to get this money when other budget things really got decreased money. So I'm very happy to hear that, and I think we all would like to thank the BMZ and also the minister. And I think it's not every day that the minister comes to an NGO conference and is announcing what the government is doing. So we would like to thank for that as well. And I think it... And it shows the importance of our issue. And I think we know it's very difficult to end the 3 diseases till 2030 and really to get back on track. And I think today we learned that Germany is really a health champion, a global health champion with leadership, and that will help a lot when the replenishment conference comes, that other governments will also get the mood, the inspiring ideas from today. And I think in the end, we hope for more than 80 million, even because we know we need more to end the 3 diseases. And I like to hear, just to get some flashlights, the parliamentarian fan club for the Global Fund. And I think we all together in this room are also kind of fan club because we know how the Global Fund works, how efficient it is, how much lives are saved. And so I think we all together are now a fan club for the Global Fund and by our different perspectives. And maybe to find some other flashlights on the 3 diseases, HIV, it was clear that UNAIDS really shouldn't be forgotten, that we know that we have to make our advocacy work with the Ministry of Health. And I think we will go on for the next years about it. And with TB, equal support is needed, and advocacy opportunities should also be equal. So we need for new, not 100 years old diagnostics, we need really more attention. We know that the money, the distribution, TB gets less, and maybe the CCMs should think about how they can change it. And for malaria, I think we all can't bear to hear that every minute a child dies. So I think we in this room know that we need smart investments, we need effective measures, and we cannot wait, because the mosquitoes are not waiting either. So that's what we learned today. And so I think to get new treatments is the second best issue. To have as much investments in prevention would be the best fast-track initiative which is going on. And as a conclusion, it's a perfect timing for our conference, for the announcement for 1.3 billion euros. And so I think we really have the chance to get more money if we wouldn't have met today. So I think I would like to thank all of you. I would like to thank, of course, the organizers. We are 7 organizations. You read our names, and it's very important to get the floor and to prepare to come together. But I would like especially to all you participants, because you were the inspiring guests. You brought in your perspectives, your views, your ideas as well. And you have a lot of knowledge which shouldn't get lost. So I think it's good to report what we are talking today. And I would like, of course, I did it already, to thank the German government. Svenja Schulze, maybe you can pass our greetings, and it would be very great. Yeah. So she made a very good day for all of us, and we shouldn't forget to thank the Global Fund itself. We had Peter Sens here online, but I think we all are happy to know, and we are excited what happens in the replenishment conference, and so we look forward to work together. And to work better together, I would like to invite you now from our organizer's side to our small reception, and have a nice afternoon. I think we will use it not only for drinking. I think mainly we will inspire ourselves, network, and go on to find ideas to end the 3 diseases. Not anytime, it really is still till 2030, even if we know it's a very fast and hard way. Thank you very much.